Hey everyone, I'm Tamara Aaronbayeva, and welcome to the August episode of our monthly webinar series, The Future of Edge. In this series, we talk about what the future will look like and what you can expect to encounter about 6 to 12 months from now in the world of edge cloud and edge computing. Sometimes we have guests from outside of Cocksack. Sometimes our webinars showcase insiders who are working on new and leading edge stuff. Today is the first time we've had the pleasure of ever having both. Alongside our own senior strategist, Nuran Muthia. We're so excited to have Sharon Fanto joining us. Sharon and Nuran are going to talk about the hospital of the future and how the cloud, AI, edge computing, and technologies like RTLS are changing hospitals. Some of you might remember that Nuran kicked off this series back in January, talking about what we could expect for edge cloud and edge computing in 2022 and beyond. So welcome back, Nuran. It looks like we're having a couple of issues that we're resolving in the background with him, but he's very delighted to be here, I can assure you. We're glad to have you back talking to us about the future, and we'll be excited to see you in a second here when we get it started. And today, oh, there he is. Hey, Nuran, welcome back.
Thanks. I had to rejoin. Sorry.
Good. Well, now we've got you. And now it's our first time being joined by Sharon Fanto from Cox ProSite. So Sharon, welcome. Before we get into the hospital of the future, what it'll look like, some of the problems it's going to solve, can you just tell everyone a little bit about yourself and what ProSite is working on? Oh, Sharon, it looks like we've got an audio issue. Hold on a sec. Sorry, folks. You know, it's always in a live show that this tends to happen. It's a rule, I think. Okay, Sharon, try to unmute. Looks like you're on mute now. All right, we see the excited finger guns, but we're having a little trouble getting audio on. So just give us a second here, folks. We don't hear you yet. Okay, Nuran, do we still have you? Just checking all the boxes.
Yeah, I'm here. Can you hear me?
Yep, we can hear you.
Perfect.
Okie doke. Yeah, we're still having a little bit of an issue with your audio here, Sharon. Sorry, guys, this is like an SNL skit about what it's like to live in, post-pandemic world. We can just pretend this is, a joke we're talking about as we think about the experiences. Pretend this is a really bad telehealth conversation. Okay. All right, it looks like we're going to give her a second to jump off and jump back on here. Sorry about this, everyone. While we're waiting, maybe Nuran, you can give just a really quick reminder to everyone of what Coxsacks is.
Sure. And just confirming you can hear me now?
Yep, all good.
Good. Great. Yeah, thanks for having me. Excited to be back. And for those of you joining for the first time and not aware of Coxsacks, right? So we are an edge cloud provider. So essentially, we're delivering cloud services out of our last mile footprint that we own and operate today across multiple regions within the United States. So we're roughly in about 20 different markets, which is roughly equates to about 18 to 20 states. And as a cable broadband provider, we own and operate a lot of these last mile networks. And what we've done is essentially delivering cloud services out of our last mile footprint. So, anyways, I think we have Sharon back.
Wonderful, Sharon.
Me now?
Yep, we can sure hear you now. So thanks for bearing with us, folks, and thanks for that overview of Coxsacks, just as a reminder for anyone who's joined us the first time. And Sharon, back to you. Since this is your first time joining, if you could give us a quick overview of yourself and ProSite.
Perfect, thank you. I'm Sharon Fanto. I am with Cox ProSite, and I'm excited to be here today. Thank you, Tamara and Noren, for having me. I've been with Cox for 20 years, and I am inside of our new growth and development group, which has Cox ProSite. And Cox ProSite, for those of you who do not know, is an IoT solution from Cox Communications that helps hospitals by utilizing real-time location services. Of course, there has to be an acronym, RTLS, to help track and monitor equipment and people inside of a hospital. And so when you think about a full platform solution, we help automate manual tasks and understand asset utilization and workflows to help promote the operational efficiency, staff, and patient safety inside of a hospital.
Amazing. Thanks for that overview. I can already tell that now our audio is working and you guys are going to have a lot to say about today's topic. So let's jump right on in. My first question is for both of you. So hospitals have a unique place in our society. At some point, everyone from every walk of life experiences a hospital, whether it's at the beginning of life, at the end, somewhere in between. Whether you're a patient or a visitor, like me, I don't even want to say how many times I've been to a hospital. And hospitals have always run on data, whether that's back in the day on pen and paper or what it looks like today. So the question is, what do we know about data and its place in tomorrow's hospital?
Well, I'll answer that first. I think about the importance of data, like anything, is only important and good if you can access it. So if data is hard to access or not timely, it loses the importance, whether it's today or in the future. And so when data comes from multiple sources, often it's siloed and it has important information, whether it's patient data, workflow data, operational data. All of that, when not pulled together in a uniform platform, makes it challenging to benefit from. And so how you make it actionable, again, thinking about today's use of data or in the future, it's about efficiency and about making sure that it comes in a way that is digestible and accessible. And so leveraging it in critical times of need is important, whether it's in the case of audit or compliance. If you think about a hospital environment, really thinking about being able to very quickly and timely access it is key.
Sure, I can. Talking about data, right? I mean, I'm going to provide more data points to kind of articulate the value of data. So giving you some context, there's roughly about 10 to 15 connected devices that's in active use in every hospital bed, and it's only growing, right? And the amount of data these devices generate are also growing. And then when you kind of come outside of a hospital setting, it's roughly about 3 million data points you're collecting in every clinical trial. So, I mean, just kind of think of that. And recently, Deloitte and MIT did a tech review, and basically 30% of all global data, stored data, is coming from healthcare and life sciences.
Wow.
So considering this amount of data, right, coming from healthcare, it's imperative to not only collect this data, but to Sharon's point, right, you have to derive meaningful insights, and you need to be able to do that in a very time efficient manner, right, in order to drive value for both the patients and for the hospital and the service providers. So that's really just the power of data, the value of data is immense, and it's only continuously growing.
Absolutely. And that leads me right into our next question. So, with or without talking about data again, what do you think the hospital of the future actually looks like, either operations wise, the patient experience, or how the tech is going to be different from what we're seeing today?
So today and in the future, there's some stats, and you guys have read it and seen it if you're following anything about staffing shortages, right? It is very real, staffing shortages and burnout. And so the estimates for the future is that's not going to get much better. So how we help that data to alleviate the burden on that staff and help the staff understand the data, again, leverage it into actionable insights and again, the quadruple aim and the elements of the quadruple aim, whether it's enhancing the patient experience, lowering population health, lowering healthcare costs, and refining the clinical experience, those continue and those continue into the future. And so being able to turn it into actionable data will make them more efficient. And again, that's all about how you alleviate the burden. You think about the staff experience. If they're spending a lot of wasted time looking for an asset, again, how can we give them a better staff experience? It begins with giving them information at their fingertips. Something like looking for a wheelchair inside of the hospital. If imagine they have that in their fingertips today with all the 15 plus assets available inside of a room, as Naren mentioned earlier. That's also about how do we give them the data that they need timely. That just is going to kind of continue into the future.
I just want to add to that real quick, just, minor data point. So obviously the pandemic, was an inflection point, right, in terms of how care was delivered, and how, we see this shift in care delivery, right? So I think hospitals are obviously very much focused on leveraging the resources and to also the point around chefs shortage, as well as clinicians shortages and things like that. And you need to kind of manage all of that. So it's really about the more critical care. Now it's really being focused from a hospital delivery standpoint, right? And then other stuff that traditionally people just went to the hospital for is no longer really being entertained in a hospital setting, right? So you have different other avenues, such as your pharmacies, now your doctor's office, telemedicine, and as well as care at home. So you're starting to see some of those traditional things are now starting to get distributed into different settings where care is being delivered.
Yeah, absolutely. It sounds like it has a really big impact on experience. Like sharing that wheelchair example. Imagine, I guess you're sitting there waiting to be, waiting to leave, go home after your visit, and the reason that you're sitting there is because no one can find the wheelchair. Like as a patient, that's such a difficult experience, and it's not great for the staff either. I want to follow up on something else you said a little bit earlier. I read that a single hospital might have hundreds of thousands of items in inventory, everything you can think of, from medicines, beds, equipment, even forks. And some of those things are cheap, like the forks, obviously, but some of those things cost more than a house. And then some of them might even cost a life if the staff can't find what they need when they need it. So how do you see something like RTLS technology really impacting hospitals now and then in the future?
Well, that's a great point, and you're absolutely right. The impact of being able to, in an ER or an ED, being able to say, they don't have time to waste. They must provide that immediate access to the information, and whether it's in a soiled room, clean room, being able to see it and know exactly before they go into a room that it's available and it's there. And again, whether it's an IV pump, a bladder scanner, any of those devices, the high value are the ones that you absolutely have. But again, an IV pump or a bladder scanner are also very critical in the time of that ED experience. So it's about really that timely access.
Yeah. And there are definitely a couple of things you mentioned that got me thinking, but before we get into it, Naren, a question for you. One of the really unique things about edge computing is that it can kind of play a part in this experience in so many different ways everywhere. So what do you see as the main role for edge in healthcare over the next few years? Where can it really help?
Sure. I mean, just to provide a little bit of context, right? What edge computing really does, it brings data processing, analytics, and storage, right, closer to the source of data generation. Now, it can be a medical device, it could be an on-premises equipment server, or it could be in-region, data center or cloud, such as what Cocksack is offering today. Something that's within the region where the hospital or where the application is being consumed. Now, edge computing, again, is very complementary to the cloud, right? What it does is it allows IT decision makers to essentially make a choice in terms of where to best place these applications across that compute spectrum, because they have these options. Now, it's really about balancing performance, cost, all of that, right? So, it's not efficient to move huge volumes of data to the cloud to process and then push it back, especially if the value of that insight is more real time, So you just have to balance those things. And especially hospitals today are generating
Mhm.
around 50 petabytes of data. So
Insane.
each year. So again, so there's edge computing can play across lots of different areas, but really, I mean, we can get into some use cases in a little bit, but there's three fundamental things that are driving the need for edge computing in healthcare.
Yeah.
One is we talked about the number of devices that are coming online, right? So you can roughly equate for every device that's coming online, it's generating 4x the amount of data. So now, again, meaningful insights, and you need to
Mhm.
determine which of those insights are more real time versus some that can be more static, right? So that's
Mhm.
where those things need to be accounted for. Secondly, the introduction of like AI and machine learning, right? Because we talk about insights. Now it's not feasible for a human to look at all this data to derive insights, right? So all of this is going to get automated, and machine learning and AI are going to help drive a lot of the intelligence in a way to help with clinical decisions much faster and a more efficient way. So those are all things that are truly driving the need for edge.
Mhm.
And the last thing is around what we talked about, like care delivery is expanding outside of the setting of the traditional physician's office or the hospital, right? So those three different factors are really driving the high level need for distributed
Mhm.
computer environment and the application, where the application workloads run.
Got it. So let's talk about some of those use cases. What are some
Sure.
particular areas in healthcare, and like who's going to be positioned to benefit the most? Surgery, patient experience, something else. What are those things?
Oh, let me just again, like I said, because the application is pretty broad, but let's focus on something that's a bit very tangible, something that's near term, something that translates to business value, right? One is
Mhm.
around imaging, so especially around diagnostic imaging that is like AI enabled, right? So you
Mhm.
have these imaging are like very data intensive. Now, it's not very efficient to move all this data to the cloud, especially if you're trying to turn around insights from that data in real time, or
Mhm.
or fast. You kind of turn that information quicker. So AI enabled like imaging is clearly an area where a lot of these images. I mean, the training of these imaging can happen in the cloud, but actually running these AI imaging more
Mhm.
needs to happen locally, so you can derive these insights in real time. So that's one area. The other area is really like, there's a lot of like more augmented and virtual reality that's coming mainstream for like clinical care as well as training.
Mhm.
So think about like delivering dynamic content in real time for like augmented virtual reality for like training sessions as well as for care delivery. So
Mhm.
that's a clear area of edge where edge can play a huge role. And then the last is around regulatory aspect of it, like
Mhm.
keeping data within the particular region where it gets generated. Like GDPR is one example of like things in Europe. You're starting to see things play out in the United States. It's just we're in the early stages of it, but you're going to start seeing where there's from a regulatory standpoint, you're going to have to keep
Mhm.
data locally versus not unclear as to where that data resides. So those
Right.
things will require a regional type of a cloud to support those requirements.
Mhm.
Just as you think about the cloud and you were talking about that, part of RTLS and it being kind of only 25% adopted in the United States, it's because
Mhm.
siloed technology on-prem, and it
Mhm.
has been a challenge to be on-prem, and the ability for us to kind of do Bluetooth low energy, be in the cloud, be using Wi-Fi in a hospital setting is, again, when we think about Cox ProSite's advantage and then our use cases, we think about the importance of the cloud for us. And then from a use case perspective, asset tracking is kind of like the table stakes. It's kind of like the important thing because it drives the ROI for the hospital. They will order less because they have better data and insights that they can see what they order before someone says, hey, I need a, $25,000 wound vac. Well, no, let me reallocate that from one department to another and cut down on either rental expenses or over ordering.
Mhm.
And so that use case for us, that RTLS, that table stakes, provides that ROI. But then you think about the other use cases that you see on the screen, like temperature monitoring or environmental monitoring. Again, that
Mhm.
manual process, the automation, that the ability for someone to say, I can see if a refrigerator was left open before the vaccination becomes spoiled and you wasted money. So those types of use cases, and also kind of staff safety, where you can actually press a button and very discreetly call for security in times of needs. And so, again, using the cloud and Wi-Fi inside of a hospital to be able to have staff find you timely, that's critical for a hospital to be able to provide that peace of mind to staff.
Yeah.
And then patient experience begins. We're used to tracking our pizza or our Uber, but we can't navigate a complex campus. And so how do we get from the outside to radiology or to appointments, or get the caregiver or loved one to find the family member? Using wayfinding and a digital front door enables them to do that. And then something as a hand hygiene compliance monitoring. It's a manual process with, secret shoppers watching to see how do you use that same technology, that same badge, using the same infrastructure that was created for one of the other use cases, and to be able to enable someone to very easily identify for leapfrog or other compliance standards what activities have been done for hand washing. So those are some of the use cases that leverage cloud and the infrastructure built one time for one of those use cases.
Excellent. And that brings up another really good point. And this question is for both of you. I know we've been talking about, the future, and we should, because this is, a future of Edge series. But, thinking about what you said, the 25% adoption for RTLS today, where is the healthcare industry overall in maturity for, Edge, RTLS, and some of the different tech and use cases we talked about today?
So for RTLS, we're in its, it's been around for a while, but it's still in its infancy. You think about $1 billion marketplace in 2020 or 21, and you look at a Gartner, or you look at an estimate for 2030, and it's at $50 billion. So huge upside, great opportunity to, again, these are just 5 use cases, but many use cases. So a very early opportunity for the future.
Sure. Yeah, from an edge, again, right? I mean, we have to be careful because of the use of the term edge. Anything that's truly latency sensitive, and where that is absolutely business critical, right? That needs to run today has been primarily being, supported within the confines of the hospital. So they have some sort of on-prem capability to support those needs, but what you're starting to see is, you still need a cloud-like experience in order to make that truly extensible, right? Because now these applications and workloads are going to expand. So it's not, and also challenges, some of these things are more siloed as well, right? Because talk about data, we need these different applications to talk to each other, to really see, to gather more holistic insights. And I think, you might have a specific need for one particular type of an application, and then in order to meet that specific requirement, you might deploy something on-prem, which doesn't necessarily, it lives in its own island, and it doesn't necessarily talk to other applications. So that's some of the challenges or the limitations in terms of, extensibility, as well as kind of having a more central, kind of a monitoring type of capability and stuff. So I think that's where, with what we're doing at Cocksack and really bringing the cloud closer to the customers, you're really, kind of bringing the benefit of using the cloud and the frictionless access to, really expanding the workload environment, but then you don't have to manage it, right? It's not on. So that's the true benefit of it. I mean, we're still in the early phases from truly leveraging that, right? Because that type of service and capability is really just coming online now. So you'll start seeing more of that where, the traditional on-prem applications need to migrate to that.
Excellent. Well, guys, I think that was the best explanation of the hospital of the future, and one of the best discussions about it I've personally heard. So this is really awesome. Thank you, Sharon, and thank you, Naren.
Thank you.
Excellent. So folks, if you have any questions for us, we have a few minutes, so please feel free to drop those into the chat for Q&A. We do have a couple that folks submitted ahead of time. So let's start with one of them. First up, what does a hospital or healthcare system that's ready for these newer technologies look like? Because they're not all ready for new tech like this.
I think for Cox ProSite, we look at a hospital that has a minimum of 150 beds. That is because the complexity of that hospital, being able to have multiple floors, the challenges that we've talked about of looking for assets. But upwards of 600, 800,000 bed hospitals, right? They have the complexity and they have the challenges of whether it's trying to find a location or finding assets. So that's, in its simplest terms, kind of what makes a good hospital for Cox ProSite Solutions.
Okay.
From from a Cox Edge standpoint, I mean, I don't want to make this very specific to Cox Edge, right? But just truly, kind of extending what we just discussed. It's really around, holistically thinking about how do you want to place these application workloads across that spectrum we talked about, right? So if, certain things are more efficient running in the cloud, then it's probably the best place to support those workloads and applications. But what you do need is you need all these different environments where, your hospital applications are functioning. You need to be able to access that in a more streamlined fashion. You need to be able to have, oversight on all of that out of a single pane of glass. You can't have, siloed type of applications not talking to each other. So those are the things that are important from a digital transformation perspective, in terms of, like, how do you strategize and architect, how these applications need to reside and where they need to reside. And also the phased approach in terms of, like, going about doing these, because you can't do all of them at the same time, right? You have to focus on things that are very business critical. And you also have to have a more longer term approach of, like, how do you, because if you're very much focused on what you're solving today, but not taking a more longer term approach, then, you end up, putting yourself in a very disadvantaged position, right? Because the data, as we talked about, is only going to increase by leaps and bounds. So you need to have a plan around that. And you need to know which are the things that are very business critical. And so I think it's really having that approach in terms of a shorter and longer term view. And again, this is going to be very different for each hospital, each provider, right? So there's no, like, one answer that applies to everybody.
Right. And that's so true, right? You're not trying to solve for one of these things. You've got to really think about the extensibility.
Yeah. I can't even, thinking about data, I can't even visualize how big a petabyte of data is. And in a couple of years, like, we're going to be laughing at that.
Yeah.
So it's not going away anytime. That's for sure. Okay. We've got another question. What are the risks or downsides of adopting these technologies today or in the next 12 months?
I think from a risk, the biggest risk is not having the buy-in, right? Because these things, you can have all the data in the world, but you actually have to have usage and you have to have stakeholders. So a biomed team that is excited to have it because it saves them time to go looking for equipment, the buy-in from stakeholders is critical. And if you don't have that, that's a big risk.
Good point.
Yeah. I mean, the other thing that, this is not, again, very specific to the healthcare setting, but what we're seeing in other verticals as well is, right, as digitization and digital transformation becomes very, very much at the forefront for businesses, right? This is, again, retail, healthcare, manufacturing. These are all not technology-led industries, but now they've become technology-led industries, right? So it's this disconnect between operationally driven, objectives versus more traditional IT. And I think there's going to be this, thing of, like, where they need to really kind of come together and make sure that, it's something is not just done, or these decisions are not just made by the operational teams versus, having the buy-in from more of the IT teams to kind of support that strategy is going to be important as you think about these trends and how, these things are going to basically evolve, right? So that's important, because if you don't think through those things, if you don't have kind of buy-in with some of these other teams, these projects are very much can fail and not really yield the best results for these various stakeholders in the long term.
Excellent. And I think with that, since we are right at 2:30, we will finish up because we want to be respectful of everyone's time. Thank you again, Sharon, for joining us today, and thanks to Naren for coming back. I think we're waiting on the next slide to pop up, where you will see some links for ProSite and Cocksack right here. You can use your phone and just scan the QR codes on the left for ProSite, on the right for Cocksack. With Cocksack, really easy to get started with a developer account for free. So go ahead and check that out. And ProSite has some really great resources. They've got an awesome white paper they just released about remote tracking systems that you should check out if you're interested in this topic. And we'll send you a recap email in a few days with a link to the video transcript of this episode. And we hope you'll join us for next month's session as well. Until then, I'm Tamara Aaron-Baeva at Cocksack, and we'll see you next time. Thanks, everyone.
Thanks, Tamara.
Thank
Thanks,
you for
Sharon.
having me.